the high-risk category is considered to be anyone age 65 and older. So most people are familiar with individuals who may be immunocompromised, who may be undergoing cancer treatment, have diabetes, are on dialysis for kidney failure, et cetera, as being at high risk. And those are all true. Those chronic conditions are individuals who are at high risk for COVID infection and for its complications. But beyond that, anyone age 65 and older is considered as well in that high risk group. So as things have gotten relaxed, more and more people are out and potentially exposed. I think that it means that people at higher risk, namely older people, are even more at risk in a sense, because people that they may be in contact with now have a higher risk of having been exposed. So their level of vigilance perhaps should be even higher. No, I think the same message holds true. So the physical distancing, and I would prefer that we use that term rather than social distancing, and we'll come to, if we can, talk about the downsides of being at home and being sheltered at home and isolated. But maintaining physical distance, minimizing your risk of connections in with other people to the extent that you can. If you are out in a public space where you may be encountering someone, even more than the 6 feet physical distance, certainly be wearing a mask. First and foremost, we don't want to overlook washing hands and frequent hand washing, not touching your face. All of the infection control principles that we've been highlighting for the last 2 months are still true and need to be reinforced even now. The age group 65 and older is extremely heterogeneous, which I think is the genesis of this question, right? You have people who are 66, healthy, running marathons. You have people who are 86 and wheelchair bound and have diabetes and multiple other chronic conditions. So yes, the risk is going to be much greater for that person at advanced age as opposed to the 66-year-old. But even with that being said, based on physiologic changes that happen in the immune system, even at age 66, that individual would still, in my opinion, be considered high risk, and these same precautions should be in place. As in most things in life, it's balancing the risk and benefit. If your parent has needs for getting their groceries delivered and making sure and checking in on them, make sure that they're getting meals and getting their medications and so forth, yes, certainly you want to interact and make sure that their needs are getting met. Now that can be done still at a 6-foot distance, wearing masks, making sure you're washing hands, all the same precautions, and then limiting those encounters to what is absolutely necessary. Limiting the time that you're exposed to them, limiting the distance, and limiting the number of those events. Well, let's expand beyond the physical precautions of washing your hands, masks, distance, and that to the other side of the equation is we're starting to see the really harmful effects that staying isolated can have on an older person, particularly if they live alone already. The lack of social contact can have really bad consequences on people's health. There's a lot of stress and a lot of anxiety associated with that. So the things that you can do, or that any of us can do to help support people that we know, our friends or neighbors or family members who are in that situation. We certainly, as you were saying, visiting your mother, you want to make sure that their needs are being met. Do they have needs to run to the grocery store? Can you help get their medications picked up from the pharmacy? Checking in on them frequently to make sure that they're doing okay. Beyond that, there are other ways that you can connect virtually, just like we're doing, if it's not through Facebook Live, through FaceTime call or Skype or Zoom. There are various ways now in virtual platforms to be able to do video chats and maintain that contact with someone. That social connection is really critical. And we want to do anything we can to minimize people's anxiety. And some of the recommendations that we've been sharing with people in this situation, I think the most salient thing that I've learned and can share with everyone is that from our mental health providers, they're careful to point out, to tell people that right now, it's okay not to be okay. Another factor is although we want people to be informed, I think right now the constant 24/7 news that we're getting, the news feed, is just provoking anxiety in a lot of people. And it's fine to take a break and unplug from the social media, unplug from the news for a bit, and minimize that constant stream of anxiety that may be escalating things for you. Making sure to take care of yourself and your body. There has been a study already that's come out that has shown that exercise, people that have been able to exercise through this staying sheltered at home, have done much better from both their physical health and also their mental health. So getting outside now that the weather's nice, get outside for 30 minutes and walk. So getting that exercise, taking care of yourself, making sure that you're eating healthy. We want to make sure that people are not turning to alcohol or other sedatives to try to deal with the anxiety and minimize that kind of exposure. We don't want to underestimate the importance of sleep. Again, back to anxiety. If you're not getting enough rest, that's going to minimize your immune defenses. So you want to support that and make sure that you're getting enough sleep, and then maintaining those connections, as I said earlier. There may be greater risk from just talking with someone if you're within the 6 feet distance than there is with a hug if you're kind of back to back or side to side. So first of all, both wearing masks, but not making facial contact, but having the ability to hug without that face-to-face contact for maybe 10 or 15 seconds. That's probably less risky than talking with someone across a table for a half an hour. So it is possible to, again, minimize that risk, but still have that physical connection. So I'll need to defer to my colleagues and experts in pulmonary disease and asthma, but based on what I have read, surprisingly, asthma and other underlying pulmonary conditions like COPD have not been highest on the list as risk factors. For example, it appears that obesity and diabetes are much stronger risk factors for COVID than have been asthma or other underlying pulmonary conditions. So in contrast to influenza, where asthma would be a very high risk factor, interestingly, that doesn't appear to be as common or as high a risk in COVID. So I think we have a lot to learn about how we're going to gradually get back into the workplace. The CDC has published some guidelines now about how we need to be restructuring our offices to conform to these risks. Several things that, and frankly, we're considering in my own division with this in mind, is staggering work schedules. So minimizing, back to your comment about exposure to the number of people and the time. So if you can stagger schedules so that there are fewer numbers of people in that same office area, that allows you to better promote the physical distancing so people are able to maintain a further distance away from each other. If possible, erect some sort of barriers, so whether it's plexiglass or some other physical barrier between people, making sure, again, masking, hand washing, all the usual things that apply. But I think adapting the work environment in those kinds of ways to decrease the number of people, the density of people, and the time that you may be exposed to someone would be some ways that you can minimize that risk. If you are in a workplace where you're interacting with people from the public, that is another layer of complexity. I think there we need to make certain that the people we're serving are aware that they need to be masked and that they need to adhere to the same kinds of precautions that we all are in the health system. Across the country and in Utah in particular, almost half of the deaths from COVID have been in residents from long-term care facilities or assisted living facilities. So this is an extremely high-risk population. Some of my colleagues in geriatrics have framed this as saying for a nursing home, what we should be doing is building a moat around the nursing home and really walling off that nursing home to protect its residents from COVID infection. That means screening all the staff, screening any visitors, and as of today, the current policy is that for both assisted living and long-term care facilities, that there is a no visitation policy. Now, there are flip sides to that, and again, downsides to that if you're not able to visit your loved one who is a resident in a skilled nursing home. So if and when that will change remains to be seen, but I think that will be the last group where we will feel comfortable relaxing those kinds of restrictions. Again, virtual visits are an option and trying to maintain that connection. I did read recently that assisted livings where they're able to bring a resident out to an outdoor courtyard, where again, back to your point earlier about being outside is safer than being inside. If they can then interact with their family member at a 6-foot distance, but they're doing that outdoors in a controlled environment for a minimum period of time, that might be one solution. But we're going to need to be extremely cautious with that particular vulnerable population. In addition to age alone, and as I said earlier, there's a wide degree of heterogeneity of risk within the 65 and older group. We're more concerned about the 85 and older group as an example. The reason for that is that they're more likely to have multiple chronic conditions. So those chronic conditions that would add to the age risk would include diabetes, obesity, anyone who is immunocompromised, they're undergoing therapy for cancer or any other medication that suppresses their immune system. That would also include people on dialysis or who have chronic kidney disease or kidney failure. So those would be the major risk factors, it turns out, that we would be concerned about. These are very common risks, and then hypertension as well. All of these conditions are very common in the geriatric population, and it would make sense that the more of those conditions you have, the greater your risk would be. I would rather that we think about COVID now as a chronic illness that we will be dealing with for the foreseeable future until we either have an effective therapy or ideally the vaccine. That's still many months away. And sadly, I think the likelihood of any of us being able to travel as we once did without these kinds of restrictions and precautions is quite some time in the distant future. And like many things in geriatrics, older people present in uncommon ways. So because of underlying physiologic changes, for example, with any infection, an older person may not mount a fever. So one of the common symptoms you see, in fact, as on my way into the building, I had to have my temperature checked. Well, for an older person, they may have a normal temperature but still be infected. So while fever is a common presenting symptom, that may be missing in an older person. So they may have unusual symptoms. We've learned about that the loss of smell and the loss of taste are some of those unusual symptoms, so that's something to keep in mind.
Which is challenging with older individuals because that starts to go anyway, right?
So yes, these are very, very difficult to discern. This is why geriatrics is so much fun, because it's a challenge to make these diagnoses. Beyond that, it turns out that presenting with confusion, altered mental status, not being able to remember, not being oriented, not knowing where you are or the day, that acute onset of confusion, otherwise known as delirium, turns out to be a common presenting symptom of a COVID infection in an older person. So don't assume just because they don't have the other symptoms of cough, fever, diarrhea, that it's not potentially related to COVID. So if you see that symptom develop in an older person, the confusion, you should have your antenna up that, gee, that could be a COVID infection and we better get that person evaluated.